Price, can you give me your thoughts on what you like about the Republican platform?
Well, this is an incredibly important question because the American people understand and appreciate that the path that we're on in terms of health care is the wrong path. Accessibility to the kind of care that people want is going down. Affordability is being destroyed. Choices of patients are being destroyed. Quality of health care is being harmed. And so they understand something else needs to be done. Something different needs to be done. And that's why I'm so appreciative of Donald Trump and what he has put together in terms of his vision. The biggest vision that he has in the area of health care is that patients and families and doctors need to be making these decisions and not anybody else. And that's the number one issue that is so important to the American people. So when you look at the policies that would flow from that, it means that the regulatory oppression that's occurring in the area of health care right now would be pushed to the side by President Trump. And I'm so enthusiastic and supportive of what he's trying to do, especially in the area of health care.
Dr. Price, what else are you hoping to hear this week in the remaining days of the convention?
Well, you had Dr. Carson on last night. He alluded to it. And again, the principles of how we get health care back on track are the same principles that reflect on how we get America back on track. And that is that the federal government ought not be making these decisions that are rightfully those to be made by patients and families and doctors. And so once you appreciate that principle, which is certainly isn't appreciated by the current administration, and Hillary Clinton would double down on the government running health care in this country. So as I say, I'm enthusiastic about the opportunities that we have right now in this year, at this time, to have Donald Trump become president and move our health care system in the right direction. What
about Medicare and Medicaid? Where do they fit into the picture?
Well, what President Trump will appreciate when he's in the White House is that those programs are going broke, that they're not able to provide the services and the benefits for the individuals who've been promised by this nation that they would receive those benefits. President Trump is going to appreciate that and recognize that the way that you get those things back on track is to fall back on those principles of health care. And that is, we need a system for seniors and for indigent in this country where they have access to the kind of care that they want, not that the government forces them to buy or move into. It ought to be affordable. Nobody ought to go broke paying their medical bills. This is craziness. The quality ought to be the highest ever, and to do that, you've got to have innovation. And then patients need choices. Seniors need choices. Folks in the lower end of our economic spectrum need choices. Every American needs the choices about who's going to take care of them, when, where, and how. And that's what Mr. Trump appreciates.
And does that include repealing the Affordable Care Act?
That's one of his number one priorities. I've spoken to him specifically about this, and he understands that Obamacare needs to go away and that we need to move in that direction of patient-centered health care.